Today, the unfortunate topic of pain, but with hopefully a nice outcome. First, I want to read two poems that have to do with this matter of pain. One is almost certain to be known to you, even if you don't remember it. And as always in a hypnosis workshop, I'd like you to listen for the things that are useful to you, as Erickson would have said, in meeting your needs in your own way and at the right time. So that you take your time with yourself, listening unconsciously for whatever is useful and letting the rest kind of recycle itself somewhere else. So this famous poem, Emily Dickinson, after great pain a formal feeling comes. After great pain a formal feeling comes. The nerve sits ceremonious like tombs. The stiff heart questions, was it he that bore? And yesterday or centuries before. The feet mechanical go round, of ground or air or aught, a wooden way, regardless grown, a quartz contentment like a stone. This is the hour of lead, remembered if outlived. As freezing persons recollect the snow, first chill, then stupor, then the letting go. Rather a mordant poem about pain, but accurate. The way psychologists speak about it as a kind of traumatic event to which people naturally respond with flight or fight or freeze. This is the freeze version of pain or torment. And then a poem I like a whole lot better by Mary Oliver. This is called Alligator Poem. I knelt down at the edge of the water, and if the white birds standing in the tops of the trees whistled any warning, I didn't understand. I drank up to the very moment it came, crashing toward me, its tail flailing like a bundle of swords, slashing the grass, and the inside of its cradle-shaped mouth gaping and rimmed with teeth. And that's how I almost died of foolishness in beautiful Florida. But I didn't. I leaped aside and fell, and it streamed past me, crushing everything in its path, as it swept down to the water and threw itself in. And in the end, this isn't a poem about foolishness, but about how I rose from the ground and saw the world as if for the second time, the way it really is. The water, that circle of shattered glass, healed itself with a slow whisper and lay back, with the backlit light of polished steel. And the birds in the endless waterfall of the trees shook open the snowy pleats of their wings and drifted away. While, for a keepsake and to steady myself, I reached out, I picked the wild flowers from the grass around me, blue stars and blood-red trumpets on long green stems. For hours in my trembling hands they glittered like fire. Mary Oliver. We may come back to these after a couple of hours. Here's a fairly recent article, the last 5 years. Brain changes under placebo. It's called placebo-induced changes in functional MRI in the anticipation and experience of pain. Many authors. Published in Science. The experience of pain arises from both physiological and psychological factors, including one's beliefs and expectations. Thus, placebo treatments that have no intrinsic pharmacological effects may produce analgesia by altering expectations. However, controversy exists regarding whether placebos alter sensory pain transmission, pain affect, or simply produce compliance with the suggestions of investigators. In 2 functional magnetic resonance imaging experiments, we, the many authors, found that placebo analgesia was related to decreased pain activity in pain-sensitive regions of the brain, including the thalamus, insula, and anterior cingulate cortex, and was associated with increased activity during anticipation of pain in the prefrontal cortex, providing evidence that placebos alter the experience of pain. The parts of the brain implicated in pain management, analgesia, or pain excitement, are different. Anticipation of pain in the prefrontal cortex, so that I expect I'm going into the psych exam and I'm expecting to do poorly and I'm afraid and everything hurts. Or I'm about to get the injection and I'm anticipating a scary pain. Prefrontal cortex. So you ask someone, what are you afraid of in therapy, and they give you a song and dance about it. Perhaps accurate, perhaps not.